Causes of high blood pressure. In most cases, the real cause of high blood pressure is not known. In such cases where there is no underlying cause, the disease is known as primary. If the high blood pressure is caused by another disease, we call it secondary hypertension. Here are a few factors that can put you at risk of developing high blood pressure. Lifestyle. An unhealthy lifestyle will raise your blood pressure over time. Choose more low-fat and low-calorie foods and increase physical activity for good health. Eat a range of different fruits and vegetables. Avoid excessive salt, sugar, or fats. Good news is that healthy lifestyle changes will help to bring the pressure down. Age. There is a natural tendency for blood pressure to rise with age due to the reduced elasticity of the arterial system. The older you are, the greater the likelihood of developing hypertension. Weight. One of the reasons for high blood pressure is being overweight. The heavier you are, the greater your risk of hypertension and other complications. Fortunately, as you lose weight, blood pressure tends to go down as well. Race. Some studies show that black subjects have a higher blood pressure than other races. African Americans are more prone to high blood pressure than Caucasians. Blood pressures in East Asian countries are generally lower than in European countries. Heredity. Family history is definitely a risk factor. If high blood pressure is commonly reported in your family, then you have an increased chance of developing it. Cigarette smoking. Smokers are more likely to develop high blood pressure and heart disease. Certain studies show that smoking tobacco only temporarily raises blood pressure, but smoking increases the risk of developing heart disease and then increasing blood pressure indirectly. Alcohol use. Drinking alcohol can raise your blood pressure to unhealthy levels. Alcohol and blood pressure are dangerous relatives that should be treated accordingly. Sodium consumption. Too much sodium is bad for your health. It can increase your blood pressure and risk for heart attack and stroke. So reduce dietary salt intake. Pregnancy. Some expectant mothers experience elevated blood pressure. Many pregnant women with high blood pressure have healthy babies without serious issues, but high blood pressure can be dangerous for both. So blood pressure needs to be monitored regularly during pregnancy. Seven foods for high blood pressure. High blood pressure is a condition that most people have at some point in their lives. High blood pressure is one aspect of heart disease, so you have to consult with a medical doctor. Here are 7 effective home remedies for high blood pressure. Broccoli. The compound sulforaphane present in broccoli helps to lower the elevated blood pressure levels. Research revealed the link between broccoli consumption and reduced risk of hypertension, heart problems, and stroke. Blueberries. Consuming a handful of blueberries at least twice a week may help in lowering elevated blood pressure and prove beneficial to patients. Blueberries are excellent sources of the phytochemicals anthocyanins that are potent antioxidants that scavenge free radical damage and oxidative stress in the body. Buckwheat. Buckwheat is nature's best remedy for lowering high blood pressure levels. The nutritional profile of buckwheat suits the therapeutic needs of hypertensive patients. Buckwheat is an excellent source of antioxidant rutin and rich in mineral magnesium. Rutin acts as a natural vasodilator, reduces the total cholesterol levels, increases the good cholesterol levels. Green tea. Research has shown that regular consumption of green tea helps to cut down the risk of developing high blood pressure to nearly half. Animal studies as well as human trials have shown the beneficial effect of green tea in lowering the blood pressure and improving cardiac health. Walnuts. Walnuts are great sources of minerals such as potassium, calcium, and magnesium. These minerals play a role in regulating the blood pressure and naturally lower elevated blood pressure levels. Besides, they have anti-inflammatory, cholesterol-lowering effect and decreased blood clotting. Celery. Celery is a good source of the antioxidants phthalates, coumarins, vitamin C, vitamin K, and potassium that naturally help in maintaining a healthy blood pressure level. The phytonutrient phthalates is the active compound that helps to relax the blood vessels and help lower the blood pressure. Phthalates also reduce the levels of stress hormones in the body. Stress hormones cause constriction of blood vessels and increase blood pressure. Sesame seeds. Sesame seeds are the oldest condiment known to mankind. It has been widely used in culinary for its nutty flavor. Sesame seeds possess the highest phytosterol content, which helps in lowering the cholesterol levels in the body. The magnesium and calcium content provide the blood pressure regulating factors that makes this ancient condiment highly beneficial for reducing hypertension. High blood pressure. Foods to avoid. High blood pressure can be best combated by avoiding certain foods and food products. This will enable the body to better manage the elevated blood pressure levels to bring it down to normal values. Just by avoiding certain foods, one can effectively lower blood pressure without medications. Here are some of the foods that an individual with high blood pressure should be limited to or completely avoided. Salt. The direct link between high salt intake and elevated blood pressure levels has been proven by many clinical studies. Patients with elevated blood pressure should restrict salt intake or, even better, totally avoid salt consumption. When the body accumulates too much salt, it tries to flush out the salt by retaining water. Retention of water in the body causes increase in blood volume, which adds stress to the blood vessels and heart, and thus increases the blood pressure. Cutting back on salt intake is the first recommendation by doctors and healthcare professionals in order to manage hypertension. Alcohol. Alcohol consumption should be completely restricted. Research has shown that alcohol consumption in people suffering from high blood pressure is unhealthy and leads to serious health complications such as stroke and even death. Alcohol is known to increase the blood pressure levels, which may cause severe damage to the walls of the arteries. This again leads to raise in blood pressure levels. Fat. Fat has numerous health implications, including increased blood pressure. Consumption of fats, especially saturated trans fats, are harmful for the heart and blood vessels. Fat increases the body weight of a person, which increases the stress on the heart, which in turn rises the blood pressure levels. High and prolonged fat consumption also leads to plaque formation, which blocks the blood vessels and constricts their size. This also influences the pressure at which blood flows through the blood vessels and raises the blood pressure. Processed and packaged foods. Avoid processed foods such as those containing hydrogenated oil, trans fats, etc. They are indirect sources of bad fats and high sodium food. Avoid fast foods, all canned or tinned foods, and salted snacks. Preservative-containing foods. Most of preservative-containing foods are also rich sources of salt and sodium. Studies show that consumption of high amount of preservative-containing foods such as jellies, pickles, sauces, increase the dietary salt consumption and cause hypertension. Frozen foods. Some frozen foods and meats may have salt that are used as preservatives to keep the shelf life of the product. Avoiding frozen foods considerably cuts back on salt intake. Most high-calorie foods. Foods such as sweets, cakes, simple carbohydrates, all fats are high in calories, which in turn increases the body weight and leads to obesity. Obesity and being overweight is one of the primary causative factors for high blood pressure. Home remedies for high blood pressure. High blood pressure, or hypertension, is known as a silent killer. so you just need to have your blood pressure checked by a health professional. The blood pressure test is simple and painless, but the results can save your life. Here are a few simple home remedies for lowering high blood pressure. Honey. Honey mixed with juice of goose, lemon, or onion consumed on an empty stomach in the morning helps to bring down elevated blood pressure. Cumin seeds. Powdered cumin seeds, about 2 teaspoonfuls, combined with honey and juice of ginger root, about a teaspoonful each, will help to reduce elevated blood pressure. Fenugreek seeds. Boiling 2 tablespoons of fenugreek seeds in 2 glasses of water until the water shrinks to about half a glass forms a concoction of fenugreek. The resulting liquid should be allowed to cool, strained, and consumed twice a day for beneficial effects. Curry leaves. A handful of curry leaves boiled in a glass of water consumed once a day will help to reduce elevated blood pressure. The resulting liquid has to be cooled and strained before consumption. Garlic. Garlic is recommended for high blood pressure. Chew 1 clove of garlic every morning and wash it down with water. Ginger. Mix 1 teaspoon of ginger juice with 1 teaspoon of honey and 1 teaspoon of cumin powder. Have twice a day. These are natural remedies from foods that we generally consume, so these are safe. It is the best idea to continue with the prescription medication and consult your healthcare professional while trying these home remedies.